Our topic is it ethical to force people with mental illnesses to take psychiatric medication? My thesis is it is ethical to force people with mental illnesses to take psychiatric medication because it will prove mental stability for those with mental illnesses in addition to those around them. Let's define what a mental illness is. A nonprofit organization that deals with medical care, research, and education, Mayo Clinic defines mental illness as mental health conditions that affect one's mood, thinking, and behavior. My first main point is people with mental illnesses who choose to not take their psychiatric medication are more likely to not be mentally stable. A good deal of mental illness patients have difficulty functioning, coping, or dealing with situations in life. Many people with some form of mental illness are unable to hold on to a job and cannot provide for themselves. They may destroy their relationships or cannot maintain relationships with others. Thus, it would be beneficial for those with mental illnesses to take prescribed medication. A Health Affairs article written by Dean Ofterheide states that across the nation, individuals with severe mental illnesses are 3 times more likely to be in a jail or prison than in a mental health facility, and 40% of individuals with a severe mental illness will have spent some time in their lives in either jail, prison, or community corrections. If one takes the time to think why an individual with a mental illness might end up in jail, he may realize that the individual did not receive proper treatment, did not take medication, and therefore the illness became severe enough to impair that person's judgment. That impaired judgment resulted in illegal activity and landed the person in prison. Furthermore, one may also wonder why an individual with a mental illness would not take their psychiatric medication. According to Mental Health America, too many people resist treatment because they believe depression isn't serious, that they can treat it themselves, or that it is a personal weakness rather than a serious medical illness. The University Health Services at Berkeley states that clinically depressed people cannot pull themselves together and get better. In fact, clinical depression often interferes with a person's ability or wish to get help. People with other mental disorders can have the same viewpoint. They cast it aside as if it is not a major problem. They may also have trouble getting help. Whether or not they refuse or are unable to receive treatment, not treating a mental disorder will only increase the risk of the disorder worsening. It is necessary for people with mental illness to take their medication to maintain mental stability. My second main point is implementing the policy would help others around them with mental illnesses. It causes emotional pain for close ones around the person with a mental illness. Family members who have to admit the person to a mental illness facility due to extreme measures are sad when they lose their loved one. Having a person confined to a psychiatric facility is similar to the person being locked up in prison. It is a huge burden for the family to lose their spouse, child, or sibling because that person is not capable of functioning and has to be committed for treatment. In addition, severe actions can cause a lack of common courtesy for bystanders. According to the Treatment Advocacy Center, when they're not being treated with medication, they become dangerous to themselves or others. An example of a person with untreated mental illness affecting others is Andreas Lubitz, the German co-pilot who crashed the plane into a French mountain. He had a known history with depression and was deemed unfit to do his job by his doctor. But he hid his illness from his employers and didn't take the medication. It is common sense to not allow the intoxicated person to drive. Therefore, it should not be up to the person who is mentally ill to determine the severity of their own illness or whether or not it is crucial to take their medication. It is not ethical to allow millions of innocent people be subjected to the potential harm that could result in the incident a mentally ill person has an erratic spur. In conclusion, it is ethical to have involuntary treatments for people with mental illnesses. Enforcing them to take their medication will increase the likelihood of their mental health and lower possible dangers that could arise due to an irrational lapse in judgment.
Yay! You said mental illness affects individuals to the point in which they cannot hold jobs. Some of the medication that people with mental illnesses take, depending on the severity of their illness, of course, are pretty strong, so wouldn't that affect their ability to hold a job anyways?
Yes, at first, but they may experience difficulty with the side effects. But the medication is designed to help them maintain mental stability. So in the long run, they should get used to it and will be able to function better than before taking the medication.
Okay. And not every hospital doctor or psychologist is well suited to treat patients. So how would prevention of patient neglect or abuse, such as drug overdosage or even prescription of drugs that are harmful to that person, be regulated?
Unfortunately, it's not possible to regulate 100% of abuse, whether it be in the hospital or with substance abuse. Nurses and doctors, however, are trained to take care and treat patients to the best of their abilities. So they should not be abusing these patients in the first place. If there is a substance abuse or overdose, these patients who are receiving the medication from their doctors, they should be going in for routine checkups. So they should report side effects if there are any. And if that's the case, then they should get a different prescription because there are lots of different brands out there.
So what about the people who can't or refuse to take medication because the medication or because the medication that they're taking is worse, the symptoms or the effects that they get from the medication is worse than the symptoms? What about for those people?
Then I guess that would be the exception because the whole point of them taking medication is for them to get better. But if they aren't, then we should have alternatives for them. But that should be the only exception.
So the topic for today is whether it is ethical to force people with mental illnesses to take psychiatric medication. First, I want to start off with a quote from Thomas Jefferson, in which he says, if people let the government decide what foods they eat and what medicines they take, their bodies will soon be in as sorry a state as are the souls who live under tyranny. And I completely agree with Thomas Jefferson and what he's advocating here, which is the belief in freedom of choice for each individual. And in this case, it includes people who suffer from mental illnesses. As Christine did say, a mental illness is a condition that affects your everyday life and your moods and your ability to think. And all of these mental illnesses are broken down into 5 distinct categories, which include anxiety disorders, mood disorders, psychotic disorders, dementias, and eating disorders. And that does mean that a lot of these mental illnesses that are categorized may not be as severe as some of the others, like schizophrenia and such. And that means that a good percentage of people, of the population, is considered to be mentally ill, however, may not know it as well. People who suffer from mental illnesses should have the option to choose whether or not they may take medication, since it is their unalienable right as a human to do so. There is a stigma for people who are mentally ill, that they are a danger to be around because they can be harmful to not only themselves but others around them, which is why they must be medicated for safety reasons, or so people say. However, according to the American Psychological Association, in a study of crimes committed by people with serious mental disorders, only 7.5% of the crimes were directly related to symptoms of mental illness. And one of the main arguments for forcibly medicating someone mentally ill is because of the safety issue. But how can we decide to medicate someone for a crime that they may possibly commit or may possibly never commit in their lifetime? Also, an alternative to medication is there's other treatments available, such as undergoing rehabilitation, as well as talk therapy, self-help, and consented medication. In one of the articles, it was said that psychotherapy is the most effective treatment for mental disorders paired with medication. But if a patient does not want to be medicated, there is hospitalization and support groups available. And forcibly treating someone is a traumatizing experience, and also discourages people from seeking care because of the fear of coercion. So that's obviously something that not people want to look for. Forcibly medicating a mentally ill person could also have negative effects on a person, such as enabling them to become permanent patients, even though they may have never been. They probably don't even suffer from the mental illness. According to Christopher Gordon, a psychiatrist and professor at Harvard Medical School, decisions to define antipsychotic medications are often regarded mainly as a manifestation of illness, an illness the person is too sick to recognize. And even though many people might reject antipsychotics because of metabolic and other toxicities, this brings to light the unwanted side effects that come from taking medications. People who take medications to treat an illness, whether it's a mental illness or another disease, should work with their doctors to understand what medication they are taking. And if you're being forcibly medicated, the patient doesn't have the option to kind of review these things, that kind of what side effects that they want or they don't want in their to deal with, especially if those side effects outweigh their symptoms. So I think that legally, even though treatment without consent is permissible only where common law or statute provides such authority, it shouldn't be, it's in the best interest of the people to want all people to have freedom of choice, beginning with medication, just because it is just something that everyone should have the freedom to do, regardless. I mean, there is the severe cases in which the law should be taken into consideration of, but overall, it's within our best interest to make sure that we're able to represent everyone's freedom of choice and what they want to do with their body and their autonomy.
You quoted Thomas Jefferson saying that if the government states what the people should intake, then it'll be like a tyranny, and it's against their human right to force medication upon them. You then stated alternative forms of help, such as rehab, self-help, and support groups. But that is assuming that they want help. So you then went on to say that 7.5% of crimes are related to mental illness. That seems like a small number, but the severity of the crimes may vary from one person to 1,000 people getting hurt. If we're allowing people with mental illnesses to decide whether or not they should take their medication, how do we ensure the safety of others?
Well, I think first off, usually people who don't want to take their medication or who don't want to be treated, it's usually people who don't have as severe mental illnesses. So it's usually people who don't even know they have a problem, who don't know that they're suffering from a mental disorder, which in most cases, I don't think they would be much of a danger to society in the first place if it's kind of a very mediocre symptom that they're having from their illness. And it's also just a risk that comes with liberty. If they don't want to be treated, I mean, you shouldn't be able to have to force someone to take medication if they don't want to. And we can't say that they have to take medication because they have the potential to do harm, when everyone included in this world has the potential to do harm to someone and has the ability to be violent to someone else. But that doesn't mean that those urges will be acted upon. And then I guess that kind of also addresses that the whole mental disorder thing is a stereotype. People will automatically be abusive or they'll be dangerous. Like you said, like the 7.5%. I know that you said on the severity of the crimes, but just statistically, a lot of people who suffer from mental illnesses aren't always violent. So that doesn't mean that we should have to take them out the streets because the potential for them to be violent is just like any other person. It's just not fair for us to be able to decide that for them. And
okay, so my partner stated that it is against basic human rights to force people with mental illnesses to take medication, meaning it's not ethical. Well, it's not ethical to allow others to get hurt. Laws are created to protect the overall population, even if it means taking away the basic human rights from certain others, such as criminals, and locking them up in jail. Therefore, if these people could potentially hurt others, then we should take away their small basic human rights. That does not mean that we are locking them up and hurting them. It means that we want them to get better. And it does benefit them. And they can maintain their mental stability if they take their medication. So overall, the benefits outweigh the costs.
Okay, so as my partner stated about mental illnesses, she said that it is necessary to take medication to create stability. However, medication is not necessary for people with mental illnesses. There are other alternatives available for all patients, including the rehabilitation as well as group therapy, self-help. And she also said that if you're not treated with medication, it makes the patient could be dangerous to themselves or others. However, that does not make them dangerous. It's again the whole stigma. In fact, it actually makes, I think, forcing them to take medication, it makes them more dangerous because they're being coerced into something that they really don't want to do. And again, the forcible medication just takes away from the freedom of choice, and it creates negative effects for patients, including trauma and other things that is just ultimately harmful to them. Then that would help the situation.